Good morning, everybody. We're here live at the Kiwanis Park in Dothan, and we are committed today to wellness in the park. And we're so hoping that all of you in the Wiregrass community and beyond will come out and join us. We are excited. We have so much to offer today. And with me, by the way, I'm Thomas, but some of you remember who I am. With me today is Nisi Danzy. She is the Education and Outreach Coordinator for the Wiregrass region for Medical Advocacy and Outreach, and she put this together. So we want to allow her to give us some directions, some words and lay of the land. So take it away.
All right. So hello, everyone. We want to ask you to come on out and join us this morning. We'll be at Kiwanis Park from 10 a.m. until 1 p.m. offering a whole bunch of different services. There's different agencies from all over the community came out today, set up to offer you blood pressure checks. We've got COVID vaccination going on. We've got sarcoa here. We're going to have them all to come up and tell you a little bit about their services individually. After they get finished setting up, we'll have them over to share with you a little bit more about what we have out here for you. So please stop in. We are offering free HIV testing as always. Stop in and check us out. We are at Kiwanis Park. It's beautiful, sunny. Come out and join us.
Yes, that's beautiful Kiwanis Park. That's 800 Deer Path Road in Dothan. And for those who are maybe less familiar, all you have to do is go to Honeysuckle Drive and turn right by Westgate Church, and you'll start to see the drive lane to access the beautiful Westgate Park, and then, of course, Kiwanis Park. We would like to extend a special thank you to our friends at the City of Dothan, as well as those who maintain and operate Kiwanis Park and Westgate Park for their assistance and cooperation today. Also, I think Nisi was able to coordinate some refreshments for today, but I think there's also a special kick for that to encourage you to learn a little bit more about your health from folks. How's that work, Nisi?
All right, so if you come out and you get this little card that we have signed saying that you went by at least five of our vendor table, you will be provided a hot lunch from Hungry Howie's. And we want to thank Hungry Howie's for making this donation for us to be able to provide you a hot lunch. And we also have water, drinks out here for you as well.
And the water has been graciously donated by Buffalo Rock. For those of us who work and live in the Wiregrass community, we know that Buffalo Rock, many know it as Buffalo Rock Pepsi, is one of the larger beverage providers within the region. It also is wonderfully philanthropic in its support of activities that support human health, the community in general. Some of you may remember that they are a major supporter and have been of Foster Fest, that literally brings out thousands to the community in downtown Dothan. So today we really want to make sure that we all as a community are coming together and learning more about our health, taking advantage of opportunities to get checked, whether that be for our blood pressure or for HIV. For those of us who work with medical advocacy and outreach, we have a long-standing, almost 35-year history of combating the HIV epidemic in this country, the pandemic, globally by partner affiliation. But we also work with other organizations that really get to the root of rural health. And rural health issues are maybe not unique, but they're so dire in some situations because of geographic limitations, economic access. These are the things that we work to try to make sure, whether you're living with HIV, diabetes, high blood pressure, obesity, substance use disorder, that we can all come together to build a happier, healthier community. Nisi, do you want to add some points to that?
Well, I just want to say that HIV, the cases are going up. So we want to encourage everyone to come out and get tested. Whether you get tested today or if you come to our office, please take control of your health by getting tested for HIV, as well as the other health issues that may be a concern as well. So, like Thomas has already said, we've got so many different services and screenings out here that you can take advantage of today. So we want to invite you out. Come on over. We're over here at Kiwanis Park until 1 p.m. And we We also, for the first 5 that get tested for HIV, you will get a gift card. So that is another incentive. I'm not going to say how much that gift card is. We want you to come out and check it out for yourself. So come on over and check us out. We appreciate you.
So it's always fun to get the freebies, and I know I'm like everybody else. I enjoy grabbing them, but it's even more so meaningful when you can have that perk. But the added perk is knowing the status of your life, your body, your health in general. So we encourage you to come out and join us. Throughout the day, we will share promos. We will also get members of our exhibitors to come up so that you can learn more about them, their agencies, the services they provide that makes the Wiregrass region so much more than what many perceive it as being, and more importantly, to get you connected with the resources that can improve your care. So we really are thrilled to be out here. It is going to be a warm day, so we encourage everybody to dress comfortably, grab those umbrellas or those fans, but make it a great day. The sun is beautiful, the weather is extraordinary, and we're here for you. We have an extraordinary list of exhibitors today, and they are here objectively, giving generously of their own free time, and no one benefited from proceeds in order to do this truly, absolutely free Wellness in the Park event. So please join us in giving a special thank you to our exhibitors today. Well, once again, we have an extraordinary list. We will continue to keep sharing that. And as I said, we will bring people up throughout the day. And of course, because this is live streaming, you're going to see a lot of us moving around. No shock. Any of us who have seen it on social media know that there's just never a way to stop anything from happening when it's live. But that's the fun of it. So we also want to extend a very special thank you to our friends at Buffalo Rock, as well as Hungry Howie's. They are with us. They often support events, not just for MAO, but other organizations in the Wiregrass. So again, please join us in thanking them. We will be back in just a moment, but I also want to share this special promotion, being that MAO is hosting the event, to help you get ready and think about the different things that we do before we start to introduce our other exhibitors and you learn more about what they do.
Rural Alabama. It's a peaceful place to live. On a clear night, you can see every star in the sky. But if you're sick and need medical care, these country roads can feel long and lonely, especially if you're someone like James, who is living with a chronic illness.
Medical Advocacy and Outreach is a godsend. It's great. It allows me to go to my local clinic and still be able to see my doctors and my caregivers, and it's just a great program. You know, the most important thing when you have a chronic illness is keeping those scheduled appointments, you know, keeping up with your doctor visits, getting your medicines on time. And if you don't do that, things can go downhill real fast. So it's very important.
Medical Advocacy and Outreach started as a volunteer organization helping men and women living with HIV in and around Montgomery. Today, we've grown into a critical healthcare provider, bringing hope to thousands of people in Montgomery and all across Central and South Alabama. Some of our patients have insurance and can afford to pay for medical services, but many can't.
Okay, would you take a big breath in with your mouth open, please? Thank you. One more time. Good, that sounds a lot better.
MAO reaches deep into the community, bringing medical care and social services to people in need. We provide testing and treatment for a variety of diseases like hepatitis C, diabetes, and HIV, as well as mental health and addiction counseling for those who are struggling to make sense of the world around them. Many of these rural patients are facing a dark and uncertain future. But MAO is their shining star, bringing hope and light to those in their darkest hour. The sickest, the poorest, no one is forgotten, even those in the farthest corners of Alabama.
Take a listen to those heart and lungs?
Our nationally recognized telemedicine program brings experienced doctors to small towns across Alabama. So a patient in Conecuh County can receive expert care from a specialist in Montgomery. And people like Sheila can get the help they need.
Hepatitis C. I didn't know anything about it, much less think that I could have it. MAO was at a community health fair giving tests for hepatitis C, AIDS, so I got tested. I'm glad that I did. My test results came back positive for hepatitis C. MAO has been my hugest support, from providing education materials to helping develop a treatment plan. MAO has been right beside me.
Today, MAO has expanded to offer dental services, social services, and counseling, and prevention services for HIV and STIs. Our continuing education program keeps healthcare providers up to date on the latest treatments for a variety of diseases. And our on-site pharmacy provides life-saving medications that many of our patients couldn't otherwise afford. From Montgomery to Marion, from Andalusia to Abbeville, MAO is there. A guiding star that lights the path for those who need a way forward. And with your help, that light can shine brighter than ever before.
It's been 30 years since MAO began helping those in need across Central and South Alabama. Thanks in part to donations from people like you, more than 1,800 patients are getting the care and support they need to battle chronic diseases like hepatitis C and diabetes. Please join us in our mission to help those who need it the most. Through your donation, you can be the star that lights their way.
Okay, wonderfully. Thank you, everyone, for we're back, and we appreciate the people that compiled that promotional presentation for MAO. I did compile some of it, but we also have to give credit to an organization called Stamps, who was wonderfully objective in pulling footage of the true regions that MAO serves. Once again, we're here today at the Wellness in the Park in Kiwanis Park in Dothan. It's July 30th. It's about 90 degrees, but it's a beautiful 90 degrees. And we have some exhibitors with us today that are dedicated to improving the health, the overall health and quality of life in the community. And to kind of give you a flavor, we're going to start by introducing you to Deborah Hodgett from Sarcoa, so that we can get a better understanding of some of the services that Sarcoa offers to the Wiregrass region and beyond. Deborah?
Hi, so my name...
Join me right in front of you.
Hey there, my name is Deb Hodgett, and I am the Outreach Coordinator at Sarcoa. We are so happy to be at Wellness in the Park. And so we are the area agency on aging in the Wiregrass area. We serve 7 counties. We serve seniors, people with disabilities, and caregivers. So seniors, caregivers, people with disabilities can call our agency, email us, and we can set them up with all kinds of community, state, and federal resources. We can bind all those resources for people, kind of one-stop shopping. And our information specialist, when you call Sarcoa, can help you find pretty much anything that serves that population or those populations. Medicaid waiver. We have Alabama Cares for caregivers. We have Senior RX, and that's a prescription program for people who don't have proper prescription insurance. We also have all kinds of volunteer opportunities. One of our biggest programs for volunteers is our Santa for Seniors. And we serve over 400 seniors during that time, and we deliver lots of great stuff to our seniors during the holiday season. So that's kind of us in a nutshell, and thank you for having us here.
I think, many of us, we may have heard of Sarcoa before. So it was really important to have that opportunity for Deborah to bring more of us up to speed as to the wealth of services that they provide. I know within my household, we take care of several aging parties, and they are critical to our life. I mean, to who we are. And we want to make sure that we do what we can to give back to them. So agencies like Sarcoa are not only extraordinary for the direct services they offer, but for their role in helping to connect people with services that are more specific or individualized to them by way of referrals and other agencies, and often navigating the paperwork that can be involved in that process.
Exactly. And if you're navigating paperwork, such as maybe Medicare plans, or you're wondering, do I qualify for Medicare? Maybe you're trying to find a senior center to work with. You want to be on a meal program. We work with 36 senior centers in the 7 counties, and we work with their meal programs. We also have our information specialists that can walk you through insurance programs, even legal issues for seniors. We partner with a legal team, and so there's all kinds of issues that seniors may have that we do kind of combined all those things at our agency. And if someone really wants to know more about our agency and all the local resources and programs, they can pick up one of our resource directories, and they can also go to the PDF online on sarcoa.org, and we have a PDF.
So again,
online.
we want to make sure you don't miss that. Sarcoa.org.
Yes, sarcoa.org. We have the PDF of our resource directory. Our offices are open, so if you want a copy of our resource directory, come on in and visit us. We are at 1075 South Brandon Stand Road.
Thank you, Deborah.
Thank you so much.
Thank you so much. So Deborah and Sarcoa and many others are waiting to speak with you today. As you can see, our sun kind of is coming in and out. So if I get a little dark at times, I do apologize. But the day continues to be beautiful, and we really do look forward to having so many of you come out. When we look at issues of the aging that Sarcoa addresses, those also are of equal concern to medical advocacy and outreach. What many people don't realize is that there is a staggering statistic amongst our youth in terms of new HIV infection, but there is a equally impressive as well as staggering statistic for those who are starting to age. And for people like myself that are willing to admit that we hit 50 and we're starting to move beyond that, is that, we're looking at about 50% of those living with HIV that are not new diagnoses. Those are people who have been living, and many of which are considered long-term survivors. These are individuals that remember the early era, before we found out that HIV does not have to be a death sentence. But these people became committed, religious to finding help, advocacy, cures. And although we still don't have a cure, it's thanks to their pioneering efforts and their resolve that they managed to continue to stay steadfast to their health and to improving the health of others. Those individuals, many of whom have now lived more than 20 years with HIV. An increasing number of them are considered undetectable. And for anyone who may not have learned, there actually is an organized effort to simplify public understanding. And it's called undetectable equals untransmittable. That simply means that if you are living with HIV and on committed treatment, and your viral load consistently is undetectable in your blood work, then you virtually have no possibility of passing HIV on to another person. And that's critical to know when you're thinking about people who are aging and aging with HIV, just how important effective care and effective resources can be, not just to their everyday life, but also to how they interact and the lives they connect with others. So please keep that in mind. And again, we're thrilled to have Sarcoa and so many others with us. In just a few minutes, we're going to bring up another one of the exhibitors so that you can learn just about what they do and how they can also benefit people in the Wiregrass. So please stay with us. And we're back. Hello, everybody. Once again, we are at Wellness in the Park in Dothan's beautiful Kiwanis Park. It may be warm, but there's a whole lot of love here today as we all bring the community together to make sure that everyone understands the resources that are acceptable to them and accessible to them. Today, we are thrilled that we are joined not only by the public coming in for their screenings and their testings, but also by some extraordinary agencies that bring services to people in the Wiregrass and what they do. And one of those has a long-standing history in this area, in this region, and it allows us to talk about wellness in a different view. Often we centralize wellness discussions only about health, but health is one part of a much more complex issue about quality of life. The other aspect that is equally important is education. So today we have representatives from Wallace College, I believe adult education, that we're going to give them the opportunity to talk a little bit about what they do and also what Wallace can do for you. So you could just join me here with the camera and introduce yourselves and just make sure you speak up so they can hear you.
Okay. Hi, I'm Amanda Clark. I'm an adult education instructor.
And my name is Ramona Riley, and I am the career coach for Wallace Community College for the adult education department. And so what we do is from GED to college degree is what we help you with adult education. All of the services that we provide to our students are free. We help them get prepared for the GED test. We also have the high school diploma option for those students who are 19 years and older as one of the options. We also offer English as a second language. We allow our students to stack their credentials with things like North Star Digital Literacy and Work Keys Certification, which is the ACT National Career Readiness Certificate. We also help students to get into college. So we know that some students are starting at that very basic education, working towards that GED, but we do not want them to stop there because basically the more you learn, the more opportunities you have to earn. So we help students get into college. We help students with job search and local resource assistance. So we just do a lot of things in the adult education department at Wallace Community College. The age starts at 16 and it goes to an unlimited age. So we look forward to friends, family, anyone in the community to come out and be a part. We also offer academic support to college students. So you may already have that high school diploma or GED, but you're now in college and you may be struggling in a subject such as math. Well, you can become a part of the adult education department and we can provide that academic support for you so that you do well in college because we are for the success of all students at Wallace Community College and just in the educational atmosphere.
And we do try to work with our students as far as their schedule. So we do offer morning classes, afternoon classes, and evening classes as well, Monday through Thursday. And we do have more than one location to service our students as well. So it is Sparks campus in Eufaula. We have our Dothan Career Center, of course, Wallace Community College, Alfred Saliba.
And so the counties that we serve are Henry County, Houston County, and Barber counties. So multiple locations, you have that chance to get that basic education. And we also offer adult literacy for those students who just want to learn how to read better. Or even writing skills and math skills. If you don't want that or don't need the GED, you can attend our adult basic literacy and build your skills in that direction as well.
So thank you, and we look forward to seeing you.
We are thrilled to have them here, and I can't begin to say how much that is. For MAO, everything began with community education. In our case, it was about helping the people living in rural South Alabama gain access to something that in 1987 was killing hundreds and hundreds of thousands of people. And yet the information was slow to be available. The resources were not there. So what started with community education to connect people to life-saving information means everything to MAO and its mission, and it always will. And for organizations like Wallace that are helping to expand the wealth of knowledge for our citizens to make their lives richer, not only through what they can achieve, but what they feel confident they know, we salute them, and we can't be thankful enough to have them join us today. So thank you both. So when we think about education, it really is something that is very meaningful and critical for MAO, and we look at it in many respects. And there is actually a very quick little promo that I'm going to share with you to kind of put that in perspective.
Get educated. Get educated through MAO. MAO improves the health of South Alabama through education and information referrals. Our customized prevention education programs in schools, incarceration facilities, and other social settings help to reduce infection by empowering everyday people to know their risks as well as how to lower them. MAO is also an approved continuing education provider, offering web-based and in-person training sessions that help build human capacity while also earning contact hours required for licensure.
And we're back. Hello, everybody. Once again, we are at Wellness in the Park in beautiful Kiwanis Park in Dothan, Alabama, bringing together exhibitors and service providers from across the Wiregrass to help you find the services you need. And when we say wellness, we think wellness in a large context. We're talking about not only your emotional health, psychological health, your physical health, your communal health, your educational health. So we want to make sure that, very much like educating everyone about the services MAO offers, that you have the opportunity to learn about these other extraordinary agencies and the services that are right there for you. And joining us now is actually a representative from Legacy of Hope. And I know probably less than I should about them, but from what I did learn, they are filling such an extraordinarily important piece of the Wiregrass community. So Eric, introduce yourself and let us find out a little bit more. Just kind of step right into it.
Sure. Hey, everyone. Thank you, Thomas, for having us. Thank you, MAO, for hosting such an awesome event. My name is Phillips, and I'm a community liaison with Legacy of Hope, and we are the state's only organ procurement organization. Our mission and vision is that we will end the wait and the suffering by shepherding the gift of life to those in need of organ, eye, and tissue transplants. Right. So we are the organization responsible for recovering organs, eyes, and tissues from deceased donors. So if you have it on your driver's license that you are a registered organ donor, our surgeons are actually the ones who fulfill that role after death and make those organs available. If you have any questions, feel free to reach out to us, legacyofhope.org. We're happy to come to events. We're happy to talk to you. And if you have any questions for me today, please do reach out. Email address is wephillips, PHILLIPS, @legacyofhope.org. Thanks for having us, Thomas.
Don't go away. Don't go away. Because I think one of the things, I try to also, because MAO's history really is so deeply rooted in HIV and chronic illness in South Alabama. I think sometimes, the agency friendships and the partnering is obvious to some and not to others. What many of you may not know about is that for a very long time, most of the time that we have been combating HIV, the two topics of organ donation and HIV couldn't even exist on the same table. That has actually changed a lot in the last several years. So that I believe now we actually have advanced to being able to transplant organs from an HIV individual to another HIV individual.
Yeah, absolutely, Thomas. So the legislation in question would be called the HOPE Act, and that's the HIV Organ Policy Equity Act that was signed into effect under President Obama. And it states that someone, who has HIV can donate to someone else with HIV. That's absolutely correct. And the same can be said for many of what people, thought are medical rule-outs. That they're not the rule-outs that people thought that they were.
And see, that's the point I really wanted us to get to. And again, the sunlight comes and goes with us. So if we look like we darken out, we're still here.
Yeah.
But it goes beyond. Obviously, for MAO, we really listen very carefully to the impact with HIV, but not just HIV. MAO has evolved to become a very unique organization, the largest of its kind in South Alabama, with multiple concerns because they're deeply rooted in improving rural health. And to know that not just HIV, other things that were just off the table in terms of, okay, well, we can't pair these two, therefore someone's not going to be able to get an organ donation. We're moving past that. And I think that, to me, is the most important thing that Eric shared, is that not just HIV, that we're finding actual answers. We're not being so quick to dismiss that we can keep lives living. And I think that's a critical point. And I'm so thrilled to have Legacy of Hope with us today and to be part of our Wellness in the Park. So do come out to see us, to visit everyone, including Legacy of Hope, Eric, and MAO at today's Wellness in the Park. We'll be right back. Thank you.
Awesome. Thank you so much.
Hello, everybody. We're back. We are still wonderfully enjoying the sunlight and the fresh air in Kiwanis Park for Wellness in the Park in Dothan, and having you with us, whether you be visiting us in person or whether you be joining us virtually. We still thank you. There are opportunities for all of us to learn what we can do to make wellness and health in general, in all of its aspects, part of our lives. So today, again, we are joined by providers, exhibitors from throughout the Wiregrass with a variety of services, from education to direct health services to counseling, therapy, and everything in need. ADPH is here offering COVID testing, COVID vaccinations. We're offering HIV testing on site with MAO. You could also request to pick up or have a HIV at-home self-test kit mailed to you to your convenience and in the comfort of your home. We call them at home, but you could literally, wherever you feel safest to do that, you can get the test and do it there. Also, we have individuals from Legal Services of Alabama. We have Sarcoa. We have Legacy of Hope. We have Wallace Community College Adult Education. We also have representatives from the larger college unit itself, which we will have talk to you later. And in a few minutes, we also are going to ask our friends from Alabama Institute for the Deaf and Blind to come and share more about the services that they offer for the residents of the Wiregrass and beyond, not to mention the services that they assist with when they work in partnership with others. So do stay with us. We are still here, and we do hope that so many of you will come out today and get tested, get screened. We have blood pressure screening. So at the very least, considering the heat wave we've under, let's get our blood pressure checked so that we know that we are safe and healthy. And we do want to extend a very special thank you again to Buffalo Rock and to Hungry Howie's Pizza. They have provided a wonderfully hot lunch and a refreshing cold bottle of water for those who speak with at least 5 of our exhibitors today. So do stay with us and come back, and don't lose track of where we are. That's 800 Deer Path Road in Dothan. That's in Kiwanis Park. And remember, you can request an HIV test or you can come out and get tested with us. But before we move along, I do want to make sure that you understand some of our motivations and why we want you to get tested for HIV.
Get tested. Half of new HIV diagnoses are in the South, but we only represent 38% of the nation's population.
It's not just a city thing. 23% of the diagnoses are right here in suburban and rural areas.
Don't think you're at risk. The truth is, everyone should be tested for HIV and Hep C.
MAO offers free, fast, confidential testing. You can get tested at our Dothan, Montgomery, or Atmore offices.
You can even find us testing in the community. Get tested with MAO.
Hazte la prueba. MAO ofrece pruebas de VIH y Hep C gratuitas, rápidas y confidenciales en nuestras oficinas de Montgomery, Dothan, Atmore. Hazte la prueba hoy mismo.
Hello, everybody. We're back here at the beautiful Kiwanis Park for Wiregrass in the Park and Medical Advocacy and Outreach's hosted event, along with our health partners throughout the Wiregrass. We are here meeting delightful people from the community coming through, getting screened for HIV, getting their blood pressure tested, getting HIV tests, and going and getting COVID tests from our friends at the Alabama Department of Public Health, along with getting COVID vaccinations if they have not had the chance to do that themselves. So as I was saying earlier, every few minutes, we are going to meet another one of our extraordinary service providers in the Wiregrass and allow you to learn more about what they do and what they bring. And that'll give you a clue also of why MAO is so thrilled to have them join us today. So we are about to kind of turn the camera over to Donna from the Alabama Institute for the Deaf and Blind, because I think, speaking as someone who has experienced the need for those services in my life, it is critical that we understand what's available and how to connect them. So without any further ado, Donna, will you join us with the camera?
Hello, I'm Donna Cantu. I'm the case manager for the deaf and hard of hearing at the Alabama Institute for Deaf and Blind in Dothan. It's the Dothan Regional Center. And what I do is I provide resources and also have educational workshops that are connected with deaf and hard of hearing. And we offer also the ATAP program, the Alabama Communication Program, for people who maybe need some hearing assistance on the phone. And they also a lending program Alabama has, and they lend out different kinds of phones, devices, even iPhones and iPads. You'd have to get in that program, you would need to apply for it. We also, along with the ATAP program, we also provide early intervention for children, for children ages birth to 3. Another service we offer is the deaf and low vision. We have a case manager for those who have seeing problems for them. And thank you so much for your time. Oh, I'm sorry. I forgot one more thing. And I forgot one more thing that's very important. We provide interpreting services with using an interpreter. Cheryl Willis is our interpreter coordinator. She also provides ASL classes at our regional center.
Thank you, Donna. Cheryl.
Hello. We have ASL classes at the Dothan Regional Center. We have some new ones that will start September 30th. So if you're interested in taking sign language classes, give us a call, 334-677-6270. Thank you.
Thank you. And make sure you send me something about that and we can push that out further.
You can clip that. No, it was live.
Thank you.
It was live.
Thank you. So we're extraordinary to have both of them with us today and to have them representing the Alabama Institute for the Deaf and Blind. The idea of those services being so critically important is, for me, not just a philosophical thing, but someone very dear to my life and the lives of so many. My grandmother was blind. She had lost her eyesight in life prematurely and managed to raise 8 children. And to her credit, have a strong role in all of their children's lives. And without her and understanding that nature, it probably would never have made us more aware of the strength and the durability of someone living with hearing impairment or visual impairment. So we appreciate those skills that they bring, the resources that they bring, and the lives that they improve simply by addressing communication and reducing barriers to communication. And I personally thank them. And I know that MAO is thrilled to have them join us today and to help connect so many with vital services to take communication away from the problem and to also open the doors to opportunity for so many. So in just a few minutes, we are going to bring up more of our wonderful exhibitors today, but we want you to continue to stay with us. And don't forget, come out. We will be here until 1 p.m. It is about 11:45 a.m. Central Time now, so we have a ways to go. Get your tests, come out, and remember, through HIV, you can understand so much more. So come out and get tested for HIV. Get your blood pressure tested, and also make sure you learn so much more about what's going on today. Thank you. Hello, everybody. We're back again today at Wellness in the Park. Medical Advocacy and Outreach is hosting this event for the Wiregrass community, not just so we can get connected and enjoy each other's companies, which we do, but also so that you have a better understanding of the resources that are there for you. And when we look at wellness at about improving the overall quality of life for everyone, from HIV to blood pressure, to diabetes, to emotional support, psychological help and counseling. But we also have something that has been hanging over us cloud-wise for the last year and a half, and that is COVID-19. So we are thrilled to also have our friends from the Alabama Department of Public Health joining us today to help provide those services, being tested or vaccinations, and critical information to you. So I want to allow Jonna. She is going to actually talk a little bit about what they're doing here today. And I would ask she also, just take a minute or two to talk about things you may not know of services locally that are available to you through their department and their division of ADPH. So take it away.
Good afternoon. I'm Jonna Cotton. I am the District Nursing Director for the Alabama Department of Public Health here at Houston County Health Department. We are here at Wellness in the Park with Moderna vaccine and Johnson & Johnson vaccine. Free vaccines for anyone that needs a vaccine. We're here to provide that. We are also giving vaccines in all of our health departments in the Southeastern District. We have 10 in our district, and we're providing vaccines in all of our health departments. If anyone listening needs a vaccine and can't come out today, you can call your local health department and they will get you an appointment, or you can walk into our health departments. We're also offering COVID vaccine testing at our local health departments. All 10 of our health departments in the Southeastern District will begin testing August 9th. However, we do have most of our clinics right now will be testing, and the turnaround time for those tests are about 24 to 48 hours right now. Alabama Department of Public Health, we are advocates for the vaccine. If anyone is concerned, has any questions, not sure which shot they want, which vaccine, is right for them, they can call the health department. We have people who are willing to give any advice, give any information, educate the public, on COVID. So if you need us, call your local health department. We're here to help you. Thank you.
Thank you, John. Also, before you go away, just because I do listen. I don't know that you all realize that I'm listening when everyone's speaking. So there's always information that I want to know myself. So I think, for some people, they don't really understand not just the vaccine, but they don't understand the testing process.
Right.
Can you just describe that a little bit for people? Like, what is it specifically looking for? Okay. And I think that'll cut through the din, because, often you get more information instead of that simplified information shared.
So at Alabama Department of Public Health, we do what's called, we do a nasal swab that tests for COVID, the SARS-CoV-19 test. Our test is not rapid. We send that to the state lab. They run it, the test at the state lab. So it's more specific for the strands as well than the rapid test. And so, we're allowing people to come to the parking lot to be tested, not come into the clinic, because right now we're only testing people who are symptomatic or people who have comorbidities that need to be tested. We'll test them too. Or if you've got symptoms, of course, we'll test. And so, and we have seen an uptake we had seen a decline, in our testing. We just went to almost testing nobody weekly, and now our rates have just soared. So we're gearing up again for an influx of testing, and we will test, and it's free.
And if I understand correctly, so the swab-based sample test that's going off to the state lab, well, when that test is processed, will that also give you an idea of if it's a specific strain, now that we are looking at multiple strains?
If the test right now, if it goes to the state lab, you're going to get a positive or a negative result. But what they are doing is running more in-depth test, but that takes longer so that they can gather the data and see if it is the Delta variant. You may not know if you have the Delta variant unless you're hospitalized on a ventilator, possibly, because you wouldn't, they would need to know that it was the Delta variant. But really, the most important thing is if you're negative or positive, is to follow those isolation and quarantine orders, and follow that really strictly, and protect yourself when you're in public, with those preventive measures. Our goal is really to mitigate and prevent COVID spread. So, any of those measures, CDC is what ADPH follows. So if somebody calls me and says, even friends, my phone's been ringing off the hook all morning with friends. And so I always guide them back to CDC because that's what ADPH uses. We use those guidelines as our guidelines. And so, I just refer them back and say, hey, they've got a great, website. If you have a question, go to the facts, answering questions part on CDC, and it'll tell you myths, facts, anything you need to know about testing, vaccines. It just gives you an abundance of information about COVID-19. And that's what we use, so we don't mind talking to anybody, but if anybody out there needs a quick reference and they can't get us, go to the CDC website. And I know it's kind of hard. There's so much information right now. We were really in information load last year with COVID, but now we're in information load with vaccines. So I understand it fully. I'm an advocate for the vaccine, but I think that it's a personal choice, for you, for me, it's our personal choice on whether we want to get a vaccine or not. And I truly believe that if anybody wants the vaccine, they'll take it. And if they want it, what our message is if you want the vaccine, we will give you the vaccine. If you don't want the vaccine, that's your personal choice. Just take those measures to prevent, the spread of COVID.
I think that's the critical part of it.
Exactly.
Just knowing the fact that it is a personal choice.
It is.
But you have to realize your full breadth of options and your personal obligations to yourself and those you love. So if you're not getting the vaccination, those other mitigating efforts become your arsenal.
That's right. Because the thing is not to give it to somebody else.
Exactly.
If you don't get the vaccine, that's fine, but you have to take measures to prevent someone else from getting it. Vaccines are not 100%. We know that. I gave a scenario earlier. I mean, my child had the vaccine for chickenpox, still got a mild case of chickenpox. So we know, they're not always 100%. COVID vaccines are not 100%. But do I think that they give a little bit of coverage? Yes, I think they give some coverage, not for everybody. Our goal, though, is whether you're vaccinated or not, whether you choose not to vaccinate, whatever, we're still in a pandemic. We still need to control the disease. We need to take those measures seriously and do what is required.
I think you mentioned earlier about the CDC website, which of course we reference the CDC website in its breadth almost every day for one reason or another. And I think that for some of us, we're accustomed to looking at that. And it is a wealth of information. The truth is very lay friendly in access. However, it's a lot of information.
It is a lot of information.
Is Alabama Department of Health still maintaining its COVID site?
We
I know
are.
the information
Absolutely.
is coming to that it's
yes.
It's streamlined.
Thank you. Thank you so much. Anybody that's watching or, anybody in the public can go to Alabama Department, ADPH.gov. And it's still difficult sometimes to navigate, but in that, if you click on C, there's an A to Z. And if you click on that little tab, it'll take you to the alphabet. You click on coronavirus, and then the tree in the left-hand corner gives you everything that you need to know.
And that's what I remembered.
Yes.
Particularly last year.
Thank you so much, Thomas, for telling me that.
We were so much involved, and we continue to be in terms of trying to, to get messaging out objectively, just to try to make sure that people are making the best informed decisions.
Right.
In life. And that became, an easy go-to for us because we also wanted to make sure that it was in line and not in opposition to the CDC. and yet it allowed us to provide that more single target place instead of having to go through the much larger CDC website architecture.
And thank you for reminding me. I should have reminded everybody that they can go there. So thank you.
But that's okay.
Thank you so much.
That's why we do this. It's about partnerships. We had an interesting conversation with one of our local media reporters, Alex, that was here earlier, and we started to talk about partnerships. And I think partnership functions in many different ways.
Absolutely.
Sometimes it's about direct service delivery, and sometimes it's about reminding ourselves in that busyness of the day what each of us does.
Yes. And we do want to partner. We love partnerships. We love collaboration with everybody in the Wiregrass, within our district, within our state. I mean, that's our job as Alabama Department of Public Health. We work for the public, and we want to be available for the public. And I think that's kind of gotten lost in the message in the last 18 months is that we want, just like you guys do, we really want to be available. And if we're not available, I need to know. But there should be no reason for anyone to say, I can't get a vaccine, because we can give a vaccine. I've got nurses going to homes, to homebound patients, giving vaccines. I've got kids. We're planning on doing back to school vaccine clinics over the next.
Is there kind of a resource, or is there a channel system for those who might be shut-ins?
They can call the health department.
So they can call the health department directly.
Sure,
for that.
they sure can.
So
we've got a new list.
Heard that, folks.
Yeah, we do. We've got a new list right now that we've worked through some of those patients that are homebound that just keep. We're sending people out to homes if they want the shot. My message today, my number one message to everybody that's listening, is if they want a shot, if they want a vaccine, they need to let us know, and we'll make it. It may not be tomorrow, it may not be Sunday, but we will make arrangements to get shots in arms. That's what we want to do. And for those people who don't want a vaccine, we're still there for them too. And we'll help them answer. We'll help them work through stuff. I just don't think anybody should be ridiculed for their decision of whether to get a vaccine or not. Of course, we want people to be vaccinated because we want to see those numbers decline. We want to get back to some normalcy. But I'm fully aware that there's people who do not want vaccines, and it's a personal choice. Just we still are in a pandemic, and I think we've kind of forgotten that.
I think we haven't often, we really do. We get so hung up with the political side of it that we forget just the public health message. And that is really what for MAO and ADPH. Our concern is literally, this is about public health.
It is about public health. It is.
One of the things that I think it always starts with information.
Absolutely.
So the thing is, if someone makes a personal choice, that's one thing, but to still be able to give them the ability to make those decisions.
That's right, and that's what we want to do, and that's what we want to do. Whether they get the vaccine or not, we want it to be informative, and we want it to be anybody in the public. Not just people who don't have insurance, not people who have insurance. We want to reach everybody. We want everyone to know. In the state of Alabama, we've vaccinated people in Georgia too. So anybody, we want people to know that we are available, and that we're available for more than just vaccines. We're available to talk to people. We're available to work through issues if they have it, or give them. All I can do is give them the information, and then they make the informed decision on whether they want to get the vaccine or not. I'm not going to criticize anyone that doesn't get the vaccine. I'm not. Like I said, it's a personal choice. They have to make, but at least I can give them the information. I've been on my phone all morning, texting, giving people information, what to do about, just questions,
I think being responsive on that other, and I think that deserves, kudos and thanks as well. Because I think, for those of us who really did see so much of the messaging and the attempts to try to create the systems to try to get information to people last year, we watched the evolution of it, and we know that at its heart, it was so many people just being able to take the call, just being able to respond to the messages that because I think often, just very much like losing perspective about the pandemic, we lose the perspective of what that means. And we're not talking about your words that mean like one or two people. What are you talking about? I can only imagine, if we actually went back and looked at the reports, I'm pretty sure the Department of Public Health probably got thousands of inquiry calls from people specifically about that.
We did.
And that was probably even,
I answered a lot of them.
and that's what I'm saying. I think we have to give, thanks and appreciation to that, because getting those people not just in the loop, in the know about what was being learned scientifically on a daily basis, and what reason for concern and what may not be a reason for concern, and where they could get care and that they should get care.
Right.
No, don't ignore it. I mean, but I think, credit really doesn't have to be given to that. So I just want to say
thank you so much. Thank you. And we're still on the mission. We want to be available. I mean, we want to help people, and I think that's my biggest message, is whether we help you get a vaccine or whether we help you get tested or whether we help you, just get informed. We just want the public. We want to be available for the public. And I think that, sometimes ADPH gets lost in public health in general, has kind of gotten lost in the mix, and people think we only do certain stuff for certain people, but we don't. I mean, we are public health, and our employees love working for our public, and I mean, you have to work in public health, and
I know that.
It's so rewarding. Even, and like I told the reporter this morning, it doesn't matter if we give 0 shots today or if we give 500 shots today. It doesn't matter if we give 1 or we don't give any. It doesn't matter. We are available if we need to give it. And I think that's, really what's important for us, is that we have staff here ready to help, give information, educate, do whatever we need to do, work in collaboration, with people like you and, MAO and our other stakeholders.
And that's the big word, people. We're stakeholder, and I think for anyone who really hasn't heard that word, that's a really good word for all of us to learn. We are all, not just for personal reasons or for professional employment reasons, we are all stakeholders in what happens, and particularly what happens in our community's health and well-being.
We want to keep our community safe. I would love to see the Southeastern District and our 10 health departments have the best vaccination rate and have the lowest COVID rates, and take initiative, to self-protect and, help mitigate the disease. So, we're here, and that's we'll do it again. We'll we've got lots of clinics coming up in August. Saturday clinics, late clinics. We're going to businesses. We'll do whatever. We just want to be available, and even if it's just to educate, even if it's just to help people decide, we're here.
Is there a, let's just, to make it easier for the people that are watching our social media feed, is there a preferred telephone number that if they don't come today
they can go to adph.gov and click on the H, which will click on the health departments, and they can reach any health department in the state of Alabama. There's all of our numbers are there, because I don't want to just reach it out for Wiregrass, because I'm sure that we've got people from all other counties, and so we want everybody. It doesn't matter if they're in Montgomery or if they're in Huntsville. You can go to any of our health department numbers on the adph.gov, and you can call us, and somebody will help you. We'll walk you through it, or come to your house and give you your shot.
There you go. Absolutely.
Yay.
Thank you.
You're so welcome. You're welcome. We're happy to be here with you guys.
We're thrilled to have you. As always, though, ADPH has always been a partner with MAO. I think in many ways an evolving partnership over the last, for MAO, almost 35 years, as needs change and the communities change in terms of their needs and what we learn and what they learn. Very much with regard to HIV for MAO is that, it is, we're here and committed to get, to the best of our ability, we encourage everyone to get tested for HIV. It is also encouraging to see the impact of more HIV testing giving way to more knowing and more people in treatment. But we still often find ourselves in the quandary of, how do you motivate somebody to do something? And it really means that, it's something that has to be on their terms, when they're ready for it. And with regard to HIV testing, just know MAO is here for you for that. When you are ready to be tested, our team will test you. They'll test you in the community at events like today's, or you can come to one of our site locations, like our Dothan office, or our office down in Atmore, or in Montgomery, or you can just request a home testing kit, and you can either schedule time to pick it up, or we can get one mailed to you. So do stay with us. In just a couple minutes, we will bring back one of our other partners to join us. And remember, we're here until 1 p.m. today, so come down, get your blood pressure tested, and get your HIV test, and get tested for COVID, or go ahead and get your COVID vaccination, all in one place under the pavilion in Kiwanis Park. This is Wellness in the Park. Thank you, everyone.
Get prepared. PrEP is a daily pill that you take to prevent HIV.
MAO offers the latest PrEP treatments to help those not infected with HIV stay that way.
PrEP, condom giveaways, and wellness programs help South Alabama residents live their best life.
Let MAO help you get prepared.
PrEP es una píldora diaria que previene la infección del VIH. MAO te ofrece lo último en el tratamiento de la PrEP para ayudar a mantenerte libre de la infección del VIH. Aprovechala.
Hello, everybody, and we are back at Wellness in the Park here in the beautiful Kiwanis Park in Dothan. It is a beautiful sunny day, not a drop of rain. Isn't that shocking for those of us who live in the Dothan community for the last several weeks? But it is a smelter. But for those of you who have spoken with 5 of our exhibitors or more, by now you have gotten ice cold water courtesy of Buffalo Rock and a slice of delicious Hungry Howie's pizza for a lunchtime issue. So we're thrilled to have those supporters, and we're also thrilled to have you. But as we've been saying throughout the day, it's not just about understanding what we do at MAO and our commitment to the communities, but it's about what those we partner with do, so that we all recognize the roles we play in making wellness truly a community vision, a community success story. And another organization is here now that I would very much like to give you the opportunity to learn more about. It is something that is, they actually do a service of very particular interest to MAO, and even more so MAO's Behavioral Health Division, because they focus specifically on mental health awareness. And for those of you who may not realize, July is Minority Mental Health Awareness Month. And if you have not learned that, shame on you. However, you can be less shamed simply by giving a minute and learning a little bit more. So I'm going to turn the microphone and the camera over to Tiffany from Equally Yoked.
Yes, thank you. I'm with Equally Yoked, which he has the shirt on. It says we're ending the stigma. We actually do forums where we bring the medical professionals and also the people that need the help together. We had one, when was the last time we had a forum? 2 months ago. We had it, and we had psychiatrists, we had mental experts. Who else? We had pastors.
We had everybody speak.
Yes. So we're trying to end that stigma. We're bringing everybody together. And we're just saying that it's we seeing that it's a need in the community. So if you need help, we got the resources. We have the basically bridge the gap in that building. We're bridging the gap.
For folks, if you haven't realized, they are a husband and wife team.
Hence the word Equally,
making a difference in this world together, as well as an agency. So, it is important for us to realize that, like all of us in committed relationships, sometimes you gotta discuss it while you're right on camera already.
Right on camera. That's how it works.
But thank you so much. We have a list of places that you could go if you are in a health crisis, or if you having health problems or anything like that. We have lists for you.
And not only that, we are completely eliminating any stigma built around HIV and AIDS. That's over with. You need to get tested. It's free. They're out here now. They do it daily.
Yes.
This is what they do. There's no judgment zone here. They're trying to help.
Yes, we both got tested.
We both got tested today.
Yes.
And since we're married and together for years, we know how this came out. And they also have, they're doing blood pressure testing. They're doing a lot. So you need to, we're getting rid of that stigma. So I'm sure if you contact them, they'll be willing to set up and test anywhere.
Right. Well, it's in the park.
It will indeed. So before y'all completely go away, I just want to ask some questions, because again, as I said initially, mental health awareness is a particular interest to MAO. I think one of the reasons is, yes, because of the work we do through our behavioral health division. However, also for us, with so much of what we've done rooted in trying to deliver effective care and remove stigma in all of its forms, it has an increased value to MAO, and most importantly, to the clients that we serve. That the stigma of any kind around why you're receiving care or if you need care can be the difference between life and death, and that's no different whether it be a barrier to physical health or mental health. And with them here today, we just want to say together how important mental health is. You have to own it. You also have to respect it, and you have to be compassionate about helping others get it without judgment. The idea of our needs as human beings are our needs. and we can resolve challenges and barriers, but if we do it together. So, join us today in saying, let's end the stigma around mental health. And most importantly, thank you for the plug, end the stigma around HIV.
Yes, and the stigma.
We have, if you've seen the promotions for it, thank you to the CDC and the federal government, but 40 plus years. This is where we're standing here. There is no reason to do anything except embrace and spread love. Right. There really is. We need to make sure that everyone is tested. I love the fact that they got tested as a couple, because it really is about knowing, and you can be part of two and still need to know what's going on with you as a one.
Yes.
So, and it makes the knowledge, it's bonding, it's sharing, and most importantly, it gives you a sense of ownership that you are in control of your body and in your health. Exactly. And to everyone out there who may be hesitant to get a test for HIV, it is no longer a death sentence. No. Treatment is readily accessible through MAO. We can make sure that you get in care as quickly as possible, and make sure that we work together. When I say we, I wish I could take the plank, but it really is our clinic teams. They work with you to make a commitment to get that treatment, the best choice for you, to help you find a way to stay committed to your treatment, and to make sure that to the best effort possible, we can get you on a path to being undetectable, because undetectable equals untransmittable. And for those of you who do test, and if you do test negative for HIV, you do know that there's PrEP. Do you know about PrEP?
Yes, we know about PrEP.
See, there you go. So
PrEP.
PrEP is a 1 pill a day treatment that can be used for HIV prevention. It actually is something for those of you who test negative for HIV but want to stay that way. And it is something that is available for people of every walk of life. It doesn't matter what your gender is, your gender identity, the type of relationship that you call a relationship. PrEP is there as another resource to help everyone stay effective, just as medical treatment is there to help HIV or individuals living with HIV become undetectable. So remember, folks, get tested for HIV.
Yes.
If you're positive, there is treatment. And if you're negative, there's PrEP. So thank you so much. And thank you.
Thank you so much.
This is Equally Yoke.
Equally Yoke.
So remember, if you need resources for mental health providers and resources within the Wiregrass, you can call or contact Equally Yoke, and they have a list that they can share with you. You can also contact MAO, and through our behavioral health division, we can offer services or refer you to others. So again, we're here today. Wellness in the Park, y'all.
Yes, Wellness in the Park.
So thank you, everybody. We'll be back momentarily. Hello, everybody. We're back here. Well, we've had a wonderful time here from 10 a.m. this morning at beautiful Kiwanis Park, and we've seen extraordinary people come and go. And thank you so much to every single one of you who got tested today, who got screened, whether it was for your blood pressure, for HIV, or for COVID. If you got your COVID vaccination today, congratulations and thank you for that. Also, for those of you who need the service providers of our people, just reach out. We will give you the referrals to everyone who joined today. You will find out that information will be put on the Facebook event listing for this event on Monday. Just look in the discussion area for the Wellness in the Park event, which will have expired by then. But also, we came to a collective agreement with our exhibitors that the temperature just keeps rising out here, and we don't want that to be a deterrent to everyone. So we are wrapping up about 30 minutes early, so it's 12:30 now. Don't be discouraged, because the services that are offered through us and through our friends today will be offered every day you need them. So do give us a call if you're confused or need information at any point. You can call our 800 number, 800-510-4704. Visit our website at maoi.org for generalized information. And of course, I want to wrap this up today by allowing my good friend and colleague Nisi to share a special message about the importance of HIV testing and how you can get tested in the Dothan and Wiregrass area. Nisi?
Thank you, Thomas. So I do want to just say thank you all for the support today. We want to thank Hungry Howie's again for the donation, Buffalo Rock, and for all of the attendees today, everyone that tested. We want to say thank you, thank you, thank you. And for all of the exhibitors that stuck out here with us in this heat, that, like Thomas said, the temperatures are rising. So we do want to say thank you. But today was about getting tested and knowing your HIV status, along with a lot of other health and wellness issues. But we want to make sure that you know that you can get tested any day of the week, Monday through Friday. We offer testing. You can make an appointment at 334-673-0494, or you can visit our website to get tested. We also offer the services where you can pick up the test and take it home and do it yourself in home testing, as well as the QR code. If you want to scan this code, we can get this kit mailed out to you. So just reach out to us. My name is Nisi Danzy. My email is ndanzey@maoi.org. So we offer testing every day. Please reach out to us so you can know your HIV status as well. Thank you.
And you'll be amongst the first to know this, but literally starting on August 2nd, so that's only a couple days away, you will also see throughout the Wiregrass area our billboards giving you at a quick glance the website and the phone number where you can either pick up or have a free at-home HIV test mailed to you. All you have to do is look for one of the beautiful faces that you will see on the closing slide of this today. Again, thank you so much for joining us here, whether you came in person or you joined us visually. Know that MAO has been there and will continue to be there for the time to come. In 2022, MAO will be celebrating its 35th anniversary year, and we look forward to having you continue to help us and help you improve the lives around us. So thank you again. Have a great day.